Hi everybody, this is Dr. Ty Vincent making an LDI based video for you about arthritis. There are lots of different kinds of arthritis. So my octopus shirt is somewhat symbolic, all the different ways you can get arthritis, right? But octopi can't get arthritis because they don't have any bones or joints, lucky them. So it's important to understand that arthritis, the term, just means joint inflammation. Itis always means inflammation, arthro means joint. So if you have stiffness, swelling, pain, deformity, in some cases, enlargement or restriction of movement or whatever of your joints, you have arthritis of some variety, right? They aren't all the same in terms of severity, in terms of which joints tend to be affected in different conditions, in terms of whether they're going to become deformed and disfigured or not. And they're certainly not the same in terms of the cause of the problem. You can have traumatic arthritis, like if you just jammed your finger really badly, you can directly damage the cartilage in the joint, and you'll have arthritis there, and maybe you will for a long time. Maybe you'll never recover because it's structurally damaged. That kind of arthritis, if it's pure traumatic related arthritis, like a car accident or something, I might not be able to help. But that's it. Any other kind of arthritis that you have, we have an LDI approach for, which is very exciting. And so there are autoimmune conditions that are always known to have been immune related that cause arthritis, like rheumatoid arthritis or ankylosing spondylitis, or the arthritis that's seen in rheumatic fever, or psoriatic arthritis. Some people have psoriasis and then it starts to cause inflammation within their joints also. So some of these have names and associations with autoimmunity, and each of those has an antigen that causes the condition. So like in rheumatoid arthritis, the antigen 90% of the time is Proteus. And I didn't figure that out. That's been known and that's been in the literature for decades and decades. And like the first gentleman who put together EPD in the 1960 era, Len McEwen, had the Proteus antigen in his EPD mixtures and could treat rheumatoid arthritis. Then when LDA was made in the United States, Dr. Schrader, he split out, the Proteus and Klebsiella antigens, and so we've been treating, those work for rheumatoid arthritis and ankylosing spondylitis, respectively. Been treating those things for a long time with EPD and LDA, and so I have mixtures like that in LDI also, formulas. So those are easy. Those have been treatable for a long time. But when I say easy, I mean it works dramatically well. If you already have some damage to the joint, that's not likely to just go away and recover. But you can take a person where they are and usually stop the inflammation, stop the progression of the arthritis. But then there are lots of other people who have unknown, unexplained causes of arthritis. And maybe they aren't destructive, they're just painful, swollen. So some of the really common causes I've seen are allergic arthritis. People will have food sensitivities, food allergies that manifest as arthritis, joint inflammation, redness, pain, and they often don't know what those foods are. But I've become very good at asking the right questions and identifying, okay, you sound like you probably have food-associated arthritis. Kids with juvenile rheumatoid arthritis, the vast majority of them actually have food allergy arthritis. It just looks like rheumatoid arthritis, but it doesn't behave the same way, which is why it's called juvenile, and it's treated as a different entity in rheumatology. But most of those kids, it stops happening when you treat them with the food mixtures. Psoriatic arthritis and psoriasis tend to respond now to the skin fungi mixture that I created. So that's very exciting. That's been working for those people. And then probably the category that I'm the most proud of is the one that was never thought to be autoimmune, and that's just plain osteoarthritis. So those of you who have, over the ages or over the years, have started to have a certain joint that just gets inflamed and stiff and starts to hurt, eventually, it inhibits activity. You go get an x-ray and they go, oh, well, you have arthritis, you have osteoarthritis. That's wear and tear, age-related mechanical arthritis. That's always been the belief. That's what I was taught. Well, it turns out that it's actually immune-related, that even osteoarthritis really should be categorized as an autoimmune syndrome, but it doesn't have a microorganism in this case that is the target antigen that we have to use. See, all those other autoimmune types of arthritis, there's some other antigen, whether it's a food or it's a bacterial organism or if it's a fungus, that is the trigger for the inflammation in your joints. But in osteoarthritis, it appears that the antigen is actually the collagen itself within the lining of your joint. So type 2 collagen is the bulk of what comprises cartilage in your lining your joints, that smooth surface that's supposed to rub on each other, right? And if you develop an immune reaction against your own collagen, your joints will become inflamed and damaged and break down. And eventually the cartilage is like all worn off. You know, the doctor says, oh, it's bone on bone, right? Well, that is an immune process. And I know that because several years ago, I mean, this is April of 2020 as I make this video, and 3 or 4 years ago now, I made a collagen LDI mixture. So it has 11 different types of human collagen made by recombinant DNA technology. I didn't have to grind anyone up to get my collagen in there. And so we can stop an immune reaction against your own collagen. So I started using that in people with osteoarthritis, and it can miraculously stop and even reverse that process for many of you, if not most of you. Even people that have had trauma to a joint, even people that have had a joint replacement. If you had a knee replacement or a hip replacement and you still have a lot of pain around that prosthetic joint, it's usually because your own collagen is still being inflamed contiguously with the prosthetic joint, and we can stop that process for most of you, it looks like. You can even see people regrowing their cartilage. If they do x-rays later, the pain has gone away, the stiffness has improved, the range of motion has come back. Their repeat x-rays later, they have new cartilage that has formed in there, which was not thought to be possible before. So the treatment of osteoarthritis with this is very exciting to me, and I take a lot of pride in that because I figured that out through a series of thought process over the years, and it works very well. So if you or anybody else you know is dealing with arthritis of any kind, there's a good chance that we can do something about it. One I didn't mention that's common is Lyme disease can cause arthritis, and other similar chronic inflammatory conditions akin to that. You know, people have these bacterial reactions that involve not just arthritis in those cases, but also they tend to have neurological symptoms and fatigue and brain fog and other nasty symptoms. But arthritis is often part of the picture in people with Lyme disease or similar conditions, so of course we can treat those things too, as you probably already know. But anyway, think about this as a treatment approach for people you know suffering with arthritis, and there's a really good chance we can help. Thanks.